Today's video is about the 7 critical things or the must-knows when it comes to healthcare and retirement. Healthcare is a big issue and a big concern for many people as they move into retirement, and oftentimes gets overlooked of the magnitude of the cost of healthcare as you move into retirement. Now, I've helped many people over the years to help plan for the retirement, to make that transition from the accumulation phase to the distribution phase. And as we're going through the planning process, we often talk about income needs and investments and all the things that are important when it comes to planning. But oftentimes the healthcare portion of this definitely gets overlooked by the people in which that we serve. So we have to bring it to their attention about how important it is for when it comes to healthcare cost. And it's not just about the premiums when it comes to Medicare or Medicaid or whatever and your Medicare supplements. It's about the out-of-pocket cost that you may incur when it comes to retirement and during your retirement that needs to be considered and built into the plan. So we're going to take some time today and talk about them 7 critical things. Thanks for tuning in to Money in Motion. My name is Walt West, founder and CEO of the West Advisory Group. We're here to teach you how to prevent money falling through the cracks in retirement. And remember, it's not what you make, it's what you keep. So there are a number of drivers that when it comes to healthcare costs in retirement, things have changed quite a bit. People are living longer. The inflation rate on healthcare costs outweighs that of general inflationary rates. It's an issue that we really need to take into consideration. Many people think that Medicare is going to cover all of their costs when it comes to healthcare. And that's simply not the case. Medicare is to help with a lot of the costs in which that you might incur as you move through retirement, but there are costs that you may have to incur on your own. And the question becomes, how might you pay for those costs? Now, when you're in retirement, obviously you no longer have an income stream from earned income because you're retired. Now you're living off the assets in which that you accrued over your accumulation lifetime. And oftentimes those assets reside in things like 401ks or IRAs, or even some taxable accounts that you might have. But remember, when you take distributions from your IRAs, that is a taxable event. So it's not a dollar for dollar exchange when it comes to your medical expenses. So you really have to take other things into consideration, and it might expedite or potentially enhance the actual cost that you have on your medical expenses, because you have to pay the tax liability. So these are many things that you need to consider when it comes to, the cost of healthcare. So we're going to talk about these 7 critical events. So the first critical thing you should consider is that high cost of healthcare in retirement. Fidelity did a study back in 2022 for those folks that were 65 and older. And they found that the average expense that they may have through their lifetime is about $300,000 of healthcare cost that they would have to come up with out of pocket. That's a pretty serious number. I'm not sure if many of you are preparing to potentially have a $300,000 expense over your retirement lifetime for healthcare expenses. Oftentimes people don't have that built into their plan, and you must. The idea behind that is that, healthcare costs continue to rise. You don't know exactly what your health might look like into the future. So obviously it's a good idea to take care of yourself as much as you possibly can. The other issue is that, when it's an oversight that we often see is that when those folks that want to retire at age, say 62, and they're not eligible for Medicare until age 65, they have to bridge that gap somehow. And oftentimes they have to go get private insurance to do that. And you must remember that private insurance comes with a premium, and that premium is predicated based on your income. So if you happen to have a lot of income, that could really elevate your monthly premium. So you have to take that into consideration as well. And oftentimes those plans don't always cover 100% of your medical expenses. So these are things you have to build into your plan and make sure that you're aware of when you're moving into retirement, that you allocate dollars for healthcare expenses in retirement. Another critical must-know is Medicare Considerations. So of course, when you turn 65, you'll be eligible for Medicare. And you're gonna have to do some research And it is a very complex subject when it comes to determining what Medicare options that you should choose, or the Medicare plan in which that you should have for you and your family. Medicare plans are not necessarily created equal, and they don't necessarily cover all of your expenses. Sometimes they'll cover dental, sometimes they won't. Sometimes they'll cover vision, sometimes they won't. They definitely don't cover long-term care expenses. So in the event that you would have a long-term care need, those typically are out-of-pocket expenses in which that you're going to have to cover. So you must consider and must spend the time to understand and research all the decisions and all the thoughts and all the processes when it comes to Medicare Advantage type programs or Medicare Gap type plans to make sure you're choosing the right one for yourself and for your family. So the third critical thing you must know is long-term care expenses. I just talked about long-term care when it came to Medicare. Medicare does not cover long-term care. But this is something that you must understand the importance and the expense that you may be involved with in the event that you had an issue with long-term care. And I know this firsthand. There's a 70% chance that someone age 65 or older will have some need for long-term care during their retirement years. It's a very important thing to consider, and it's a real risk that you might face. And the average cost for long-term care is over $100,000 a year. If you need skilled nursing home care and you're in a facility, it could cost you over $100,000 a year for that care. It's very important to build this potential expense into your overall retirement plan. I have seen retirement plans get derailed by limiting or underestimating this risk of long-term care. So you must plan for this. So the fourth critical must know is the depletion of your retirement assets. If you're not planning properly and not building in the potential risk of healthcare, you could be depleting your retirement assets, especially if retirement assets are designed to support your day-to-day income needs, your needs and your wants. If you have to now start to pay for an exorbitant amount of healthcare costs, obviously that's going to have an impact on your lifestyle. So you must understand that this is a real issue and it's something to take into consideration. So you should really stress test your overall retirement plan to determine whether healthcare expenses would really impact your lifestyle over your retirement. So the fifth critical must know is your lifestyle and your health and taking care of yourself, right? So this has nothing to do with finances, but it does have to do with your life expectancy. So part of your plan, your overall life plan, your retirement plan should be living a healthier lifestyle. If you're taking care of yourself, you're living a healthy lifestyle, you're eating right, you're exercising regularly, this is gonna help to offload the risk of healthcare costs in retirement. So this goes hand in hand with your retirement plan. This is all part of your lifestyle plan, but this really is something of importance and you should consider as you navigate yourself through retirement. The sixth critical must know is tax considerations. For those of you watching this video that aren't retired yet and have the ability to save money in a tax advantage account like a health savings account where you could start to contribute dollars on a tax-free basis and have distributions tax-free for healthcare costs, this is something that you should really consider and try to maximize those contributions. This could really offset the risk of healthcare costs in the future. Because first and foremost, any distributions from a health savings account come out tax-free. So you can eliminate the cost of paying taxes to the government. This is very important to understand to take advantage of these types of programs if you're eligible. And the seventh and final must-know critical thing is really planning and management. This is not a hope, a dream, and a prayer, folks. This is something you need to sit down, spend some time, and you really should spend time before you retire and understand all the healthcare concerns, issues that you might have as you move into retirement. First and foremost, you should really take a look at your own health at that particular point in time when you're thinking about retirement. Do you live a healthy lifestyle? Are you in fairly good health, or are you not in good health? This is going to have a big impact on your decisions in which you make as you move into retirement. This is a big issue. This is something you should continue to evaluate over time and to make sure that it is built into your planning process. Again, thanks for tuning in to Money in Motion. It's been great to have this video with you. If you like it, please follow us and subscribe down below.